Welcome into To Your Health, and we are so thrilled. I know those of you who watch us all the time have met Dr. Will Rutland in the very beginning when the UAB Regional Montgomery Medical School was trying to establish a psychiatric residency. Well, they did it, and Dr. Rutland is directing all of it. We are so grateful to have that and to have you.
Well, I'm thrilled that it's up and running now. You know, it's just such a joy to see our trainees here in Montgomery providing expert mental health care to the folks of Montgomery and the surrounding river region. It feels triumphant to see it actually happening, and we owe a lot to the community around us for making it happen. So I'm real grateful.
Finally, I mean, we're walking the walk and not just talking the talk.
That's right,
But,
it's happening.
Talking about talking the talk, we've had so many talk about, like, the holidays are coming up, Will.
Oh, sure.
And it's an easy time to be depressed. You know, everybody thinks about some of the good, but, you know, there are a lot of folks hurting over the holidays.
Oh, too right. You know, it's just such an incredibly emotional time of year. And some of those emotions can be joyful, and we hope that they are. You know, the reason for the season is a joyful one. But oftentimes those emotions can tend towards sadness or loss. And there are a lot of drivers for that, you know. You can just have the holiday blues. It seems like every time you turn on the TV, if you're watching Hallmark movies, you're seeing joyful relationships or joyful families. And if you're feeling a bit alone yourself, certainly that can bring on, you know, the blues, and that can be difficult to deal with. And connecting with your friends, your family, your faith community, anybody out there that can provide you that support will help with those holiday blues. It's also a tender time for grief or loss. And so it can be something more than just the blues. You know, I think loss is never more exquisitely felt than when you're sitting around the family table and you notice that empty chair.
Yep, that's right.
And I think that can really bring people down, as it is perfectly legitimate it would do. What I often recommend to my patients who are dealing with grief around the holidays is think of a way to commemorate your love for that person. If they had a favorite holiday, you know, side item or meal, cook that meal. If they had a favorite Christmas song, listen to that song. So, you know, there are ways to bring them into the event with you, and that can really help and give you an opportunity for catharsis. So that can happen. And of course, you can have regular old depression. Depression doesn't take a holiday at the holidays, and so you know, it can feel more profoundly felt around the holidays. And certainly, people should continue to do all the things that help with the depressive disorder. So, little things like get outside, you know, enjoy nature. If you have the option to go cut down your own Christmas tree, go cut down your own Christmas tree. You know, go out into the you know, there's a couple of great places around. Go out into the woods and get that Christmas tree. Spend some time with nature. Do some exercise. Get outside, walk if you can. If it's not too cold, go into the YMCA if it is too cold, or wherever you might, you know, get on a treadmill or something. That behavioral activation is about equivalent to a low dose of an antidepressant in how it will improve your mood. Eat healthy, but indulge when you need to. I'm not saying, you know, eat Christmas cake every day, but when it's the appropriate time,
don't eat the whole kilo.
Not the whole thing, but you know, when it's time to eat a slice of Yule log, eat a slice of Yule log. That's okay, you're allowed. And then there's something interesting that can happen that coincides with the holidays, but actually isn't driven by the holidays.
Wow.
So as everybody knows, you know, you learn sometime in you know, natural sciences in junior high, the days are getting shorter in the winter. And that means we have less natural exposure to light. And that can lead to something called seasonal affective disorder. You may have heard about this.
I have.
You know, and so this is us being too clever in mental health. So the acronym, of course, spells SAD.
SAD.
And that's, in fact, how you feel. But it's a really interesting condition. It's caused by melatonin, which is, as everybody knows, something you can pick up on the shelves at CVS or Walmart or wherever. But it's also a natural hormone that's made by the pineal gland in your brain. And it's a signaling hormone that is supposed to help you fall asleep. So that's why people take melatonin before they go to bed. However, it is naturally activated in the body in the dark. So that's when our brain would normally produce it. When you have more dark hours during the day, however, you can have more melatonin than you need. And that can lead to some feelings of depression or dysphoria where you're just not energetic or enthusiastic.
So there's a totally scientific reason for that.
That's exactly right.
Okay.
And the cool thing is there's a wonderfully scientific way to solve the problem.
Great.
So it turns out that if you expose yourself to bright light for a certain amount of time during the day, you can actually correct the problem. So you stop the flow of melatonin and your spirit naturally lifts. So you don't have to take medication. You don't even have to get out and exercise. You just need what's called a light box.
Okay.
And there are all sorts. You'll find them on the internet. If you type in light box and seasonal affective disorder, you'll see 10,000 products. There are some guidelines on the ones that work better. And so maybe I'll share those just in case anybody needs to go buy one. What you really want is a bright light box. So you want it to be between 2,500 and 10,000 lumens.
Whoa. Okay.
Which is quite bright. White light as opposed to blue or green or red. Usually a wavelength between 400 and 700 nanometers. Now I know I'm getting super nerdy here, but that will all be on the packaging, believe it or not. So if you're looking for light boxes at your local store or on Amazon or whatever, you'll be able to control for the wavelength and the quality of the light, that sort of thing. And once you get this light box, which shouldn't be too expensive. Last time I checked, you could get one for maybe $30 to $50. You plug it in, and the real trick is you need to spend 30 to 60 minutes in front of that light box every day, preferably in the morning.
Okay.
So something you can do if you're a reader or if you do a devotional, in the morning, get out of bed, turn on that light box, go sit at your table, kitchen table or desk or whatever, do your devotional there while that light is hitting you, or while you're reading your favorite novel, or you know how I feel about personal digital devices, but if you have to play on your phone and do the crossword or whatever, fine, play on your phone if you have to, but spend 30 to 60 minutes in front of that light, and there's very good evidence that that's going to help your seasonal affective disorder lift.
Thank you for giving us the ideas on something to cure, for the cure.
That's right.
Okay, thank
That's
you.
something you can do.
Thank you, Dr.
ma'am.
Rutland. We appreciate it, and thank all of you, and try some of these things, and we'll be right back.